This is a CTV News special presentation. Tonight,
anybody can catch this disease. He didn't want to die.
When I heard that I tested positive and that I had the disease, it scared me.
There is a great concern that we will not have enough ventilators.
I would be gasping for air.
I think it's time for us to have a lockdown.
Canada has never faced a situation like this.
We are in an extraordinary situation.
Think of others right now.
Think of ways you can help to ensure that we get through this together.
Canadians contribute by doing the right thing.
We must flatten the curve and help stop the spread.
This is a serious moment in our history. COVID-19 will test all of us.
Physical distancing.
You don't need to be out. Stay home.
You must stay home.
Stay inside. Stay home.
Stay home.
Stay home.
CTV News, 20 questions on COVID-19. Reporting tonight from the CTV National Newsroom, here is Lisa Laflamme.
Good evening and thank you for joining us. As the coronavirus disrupts our daily lives, we are devoting this entire hour tonight to battling the wrecking ball armed with information. We asked you what you want to know about COVID-19, and out of the thousands and thousands of submissions we received, we've narrowed it down to 20 questions, so the highest priority themes that ran through so many of those questions. So you may want to have a pad of paper nearby and a pencil to write some of the answers down. CTV's infectious disease specialist, Dr. Abdu Sharkawi, joins me now tackling these questions. Are you all set?
I'm ready.
Okay, let's go for it. 20 questions in 60 minutes. We'll start right now with question number 1. It comes from Josie, who emailed us asking, what is the difference between self-isolating versus quarantine? Can I go visit my 85-year-old mother who lives alone? Great question.
Excellent question, Josie. The difference is subtle but important. Self-isolation is a strategy that is meant to separate someone who is ill or presumed to be infected from others so that they don't spread the infection to those that are going to be vulnerable. Quarantine, on the other hand, refers to a strategy that is used to separate those who are not yet ill and not infected, separating them from a pool of others who may be. We've seen that employed at a mass population level in China and Italy, for example. In terms of visiting an elderly parent, that's something I hear a lot. It's important to make sure that, number one, when you're visiting them, you employ excellent hand hygiene, you do wear a mask, try and maintain a distance of 6 feet at all times, and remember that you should be there only for essential reasons, to provide food, medicine, and other support that's essential. And don't forget, you can reach out and connect in many other ways, by phone, by FaceTime, by texting, by email. You can stay in touch without having to be there physically.
So important. And like Josie, so many other Canadians are looking for answers on the rules around isolation. I got an email last night from Melissa in Manitoba facing the very same dilemma. Now, her elderly parents both have underlying conditions but are otherwise healthy. So her question is, after 14 days, can Melissa bring her parents back into her home with her and her husband and her kids?
It's reasonable to have your parents in your own nuclear home, and they need your support. It's probably still preferable to maintain physical distancing of at least 6 feet whenever possible.
So the parents could move in after that 14-day period of isolation. They can move into a daughter, a son's home, as long as they maintain that distance.
Certainly, and I would always recommend that if there are young children in the home, please try and maintain a minimum of contact, if none at all is possible even.
Okay, now the purpose, of course, of all of this physical distancing is to flatten the curve. So let's go to question number 2.
My name is Greg. This is my son, Orion. We live in Ottawa. My family would like to know, how will we know when the curve is flattened?
His son doesn't seem too bothered, but before you answer Greg's question, explain to us the concept of this curve.
Yeah, so the curve is essentially a graphic representation of the rate of rise of infections and how it's spread out over time and the total number of infections that result during a given epidemic or pandemic. So when we talk about the rate of rise of new infections, that means that the infections are maybe doubling at a fairly steady rate and may increase exponentially over the course of a few days. That means that the curve is going to be very steep, the slope is going to go up rapidly, and the concern there is that that will overwhelm the capacity of the healthcare system to maintain it. When we talk about flattening the curve, we talk about not necessarily changing the number of infections that are going to happen during a pandemic, but rather having them occur more gradually and spreading them out over a greater period of time, which means that you won't exceed the healthcare system's capacity to manage them and to prevent death. We'll know that we're flattening the curve over a period of weeks when we see that the rate of rise is slowing and that we're able to maintain our capacity to deal with new cases.
So the only way to avoid that sudden peak, which is a crisis for the healthcare system itself, is to stay in your homes, isolate, quarantine, to slow the spread of this.
Absolutely.
Flatten the curve, plank that curve. Okay, we're going to go out west now for question number 3.
Hi, my name is Cindy. I'm from Edmonton, Alberta. I'm wondering, is it possible the coronavirus has been circulating for a lot longer than we realized? My family was very ill with the flu in the middle of February, and we had all the same symptoms. We also had our flu shots.
Such a great question, Cindy. Dr. Charkawi, what is your view on that?
Yeah, it's a tricky situation because, of course, COVID-19 emerged during seasonal flu, and during the time we see a lot of different respiratory viruses circulating. It's quite possible that, Cindy, you and your other family members did have COVID-19. We don't know exactly when community transmission began here in Canada and when it became travel-linked, becoming community transmission. The good news is it sounds like you've recovered, and hopefully you won't have any ill consequences going forward.
What about that antibody diagnostic test they're trying to develop so that when this crisis is over, people can get checked to see if they had it at some point earlier?
Yeah, that's something that's being worked on from a research and epidemiologic point of view. I think it'll be helpful to look back and to understand the scope and extent of this pandemic. But I don't think it's something we should focus on at this point in time. I think the essential thing now is prevention and good infection control measures.
Okay, so once someone is recovered from an illness, is there a way to test them for COVID-19, or is it the test only effective if you're showing symptoms?
The test will likely only be effective if you are symptomatic or you're within a specified period of time where the virus is still circulating in your body.
And the testing protocol delayed the diagnosis for a Milton, Ontario man who died from COVID-19 earlier this month. Sean Cunnington was a musician, father of 3, and devoted husband to his wife, Terry.
He was the most caring, most loving, genuine person. He was my everything.
Sean had a chronic form of leukemia, but was otherwise healthy and fit when he developed flu-like symptoms. He hadn't traveled internationally, so he did not fit the criteria for COVID-19 testing. Eventually, his condition was so bad, he was finally tested, and Sean's results came back positive 10 hours after he died. So for our 4th question tonight, Joanne from Cornwall asks, since the 51-year-old from Milton died of COVID-19 without having traveled or direct contact, local transmission being the source, are flu symptoms being taken more seriously now by public health for testing, or is self-monitoring and monitoring symptoms until they worsen the only way to personally deal with this?
So first of all, I want to extend my deepest condolences to Terry. That's an absolutely tragic situation. My heart goes out to you. But I think it highlights the importance of recognizing that this virus and COVID-19 does have many faces. And one of the lessons we've learned from these tragic examples is that we do have a heightened sense of awareness for symptoms that may be nonspecific, particularly in people who are immune compromised. And certainly that is something that is at the top of the mind of most healthcare professionals going forward. So rest assured this is something that is not being taken lightly.
But Joanne is certainly not the only one asking that. I mean, this is such a mystery how Sean got that virus in the first place. Doesn't that impact the official count, though? If, you know, people who likely have the disease but are being told don't be tested, or doesn't it matter anymore, the official tally?
It still matters because ultimately we want to identify as many positive cases as we can and to inform them regarding the need for self-isolation and preventing contact with other people. But we do ask people to be very patient. This is going to take some time for the testing leg to catch up with the demand. And what you should do is, if you are waiting for your test results, try and self-isolate to the best of your ability until you can get the test done. There's really no other alternative right now.
Okay, all right. And when a crisis like this hits on such a massive global scale, we tend to focus, rightly so, on the people closest to us, the ones we love. So our next question, our set of questions, zero in on the domestic dilemmas. Question 5 is from a young woman named Annie.
I'm wondering what I can do as a 21-year-old to keep my parents and grandparents safe who are all over the age of 55.
Thank you, Annie. I'm sure that is weighing on the minds of so many young people. What is your advice to Annie?
It's an excellent question, and it's a bit of role reversal. Our parents and grandparents have been taking care of us their entire lives. Now it's our turn. We have to shelter them physically and literally. We have to make sure that we keep a distance from them, particularly when we're talking about younger children who tend to be amplifiers of infection, even if they don't seem to get very sick from COVID-19. If you are in close contact with your grandparents because you have to help them with food, with medicine, etc., wear a mask, wash your hands vigilantly, apply all of those basic common sense measures, and if you can keep them in their own space, in a basement, for example, or some other suite where they have some freedom of their own without having to be encumbered by coming across other family members, by all means, you should take that opportunity.
Now, Annie is obviously a very conscientious young woman, but what about those who feel invincible, who are not exercising physical distancing? What's your message to them?
You're not invincible, and all you have to do is look at the recent reports out of the United States where we're seeing sometimes 20% of the cases that are showing up in hospital are younger people, people under the age of 40, and some of them are getting very sick. We have to remember that this virus is new, so the greater exposure it has to more human hosts, the more likely it is to mutate, the more likely it is that a more aggressive and lethal strain will be the one that you acquire. Everyone has to take this seriously. It's not an old person's disease. It's not a weak person's disease. It's everyone's disease. It's everyone's responsibility to do their part.
Which is why this is just so critically important for everyone to self-isolate, to quarantine in their homes. But every parent out there is wondering, will the kids be all right? The kids are wondering the same question. So here is question 6.
Hi, my name is Artagash. I'm 13 years old. I live with my mom in Hammond and with my dad in Ottawa. My mom has a boyfriend, and he has kids. He shares with his ex-wife. My question is, what do we do with all the kids traveling from home to home?
Such a great question. Thank you, Zara. By the way, her 2 sidekicks are her sisters, Talisa and Eleonora. But for joint custody, these kids that do go back 1 week with mom, 1 week with dad, and it's so many blended families in Canada, what's the best advice?
I think that this is the time to be creative, to be accommodating, and to try and compromise, remembering the fact that any movement that's unnecessary between one domicile, one residence, and another should really be avoided. So if that means that visitation can change temporarily so that one set of parents or one home can be the homestead for a few weeks rather than just 1 week, that's probably preferable. If that compromise can't be made, obviously, you have to pay strict attention to hand hygiene. You have to make sure you're disinfecting all common surfaces and really be vigilant about that. But that's not the ideal option.
The ideal option is to think of the kids right now, not that acrimonious, possibly relationship during any kind of that joint custody situation. Doctor, thank you for that. Now, we are going to face question number 7 head on.
Hi, my name's Adrian. I'm from Edmonton, and the question I have for the doctor is, can COVID-19 stick to my beard and mustache? Can my wife get sick from kissing me?
Can't believe how many people ask that question, Adrian, and that his cameo, the cameo from his wife, so that was fabulous. But Dr. Charcot, break down the beard situation for us.
Yeah, it's an excellent question. And the truth is that COVID-19 can really stick to any part of our bodies. The simple answer is try and make sure that that part of your body is clean. And COVID-19 can easily be eradicated using soap and water. So if you're able to maintain good hygiene, wash your face, go ahead, Adrienne, smooch away.
You know, it's funny because soul patches and side whiskers got the attention of the U.S. Centers for Disease Control. We all sort of had a laugh at the time, but if we remember that graphic where they had the various facial hair, give us an explanation, the reason behind the seriousness of this. There's the graphic.
Well, I think the facial hair issue is more relevant for healthcare workers or those that are going to require a tight seal mask, an N95 mask for high-risk procedures. For those people, any degree of friction between the skin that is brought about by facial hair, especially a beard, is going to impact the tightness of that seal and may make it faulty. And so really this is something that relates specifically to healthcare workers and to the subset that are doing high-risk procedures. For members of the general public, I don't think this is important. If you are helping with an elderly parent or someone else who may be at risk, a surgical mask or some other substitute is more than adequate.
But they don't have to shave their beard, just maintain good grooming habits.
Exactly.
Okay, that's great. Question number 8 is from Diane Stringer in Penetanguishene, Ontario.
My question is about folks driving taxi. We're being told to come into work and we're happy to get people from one spot to another, but we are in an enclosed sort of space. Are we considered an essential service? I'm happy to help my neighbors, like I said, but what should we do?
That is such a great question, Diane, and it really does apply, Doctor, to so many people. I've received a lot of emails also from not just taxi drivers, but truckers asking, what do you do when you have to be in a confined space?
A great question, and thank you for taking people to grocery stores, to pharmacies, to hospitals, any urgent medical appointments. It really is an essential service. And it's important to protect yourself. And really the simplest things you can do is to make sure that you address hand washing. So have a bottle of hand rinse or hand sanitizer next to you and use that between pickups of customers before and after. And open your window. Try and open 1 or 2 windows to get some air circulation and some air flow so that if there is a possibility somebody is infected with this, hopefully it'll go right out the window and not into you.
And a lot of premiers have addressed, and medical health officers, the question of transportation, taxis, buses, this kind of thing as essential service. So really look to your own community to get the exact answer for where you are on whether it qualifies. But by and large, as you say, it's a very critically important job right now. Now, a lot of you are clearly hungry for information because you sent us so many questions related to food. Let's start with this one from my own hometown, Kitchener.
My name is Kathleen. My question is regarding takeout food. Now that most restaurants are closed and we might be looking to order in, I realize when the food arrives at the house, we need to be diligent with the wrappings. But my question is, how much do we need to worry about the source, the kitchen where it was prepared, the people that prepared it, and the journey to my home?
Full disclosure, Kathleen Laflamme in Kitchener is my own sweet mother, and it is so nice to see her face. But Doctor, she's watching, so help us tackle the takeout question that so many people have asked.
Excellent question. I think obviously we have to have some degree of confidence in the hygiene standards that we are getting our food from, whatever that source may be. But more importantly, we have to remember that the COVID-19 virus is not believed to be transmitted through food. We don't think that it lives on the surface of food wrapping or anything and thriving in great quantities. So the best thing to do is to take the food out of whatever container it is, dispose of those containers immediately, and remember that you're getting the virus, number one, by touching it with your own hands and then touching your own face. So if you are diligent with your hand hygiene and you're not introducing anything to your mouth, your eyes, or your nose, you're going to be just fine.
So take the takeout bag from your front porch or wherever, walk in the house, immediately wash your hands, take it out of the wrapping, wash your hands again. Good. key. Now, there are two kinds of people, those who prefer takeout and those who love to cook. Personally, I think you can do both. Here's a relatable question from Francesca, number 10.
My question today for the doctor is, should I be concerned about bringing groceries home that may have been handled or touched by someone who has the COVID-19 virus? Essentially, are there any precautions that I should be taking? Thank you.
Such an interesting question. She is definitely not alone. What about groceries?
No, I think that the need to be excessive about, wiping things down is really something we not be too terribly concerned about. Remember that grocery store employees are coming in not sick. Hopefully they don't have the virus. And again, hand washing is going to be much more important. When you bring your food home, if you've got fruits and vegetables, wash them like you ordinarily would.
Anyway.
If you're talking about dry packaging, a cereal box, etc., again, the virus is not going to thrive on these surfaces. So as long as you're maintaining diligence with respect to your own hand hygiene and avoiding touching your face, you're going to be just fine.
So you don't have to take a wipe and clean off the tuna can or whatever you bring in.
If it makes you feel better and gives you peace of mind, go ahead, but it's absolutely not necessary.
And so let's try, as well as we can with a mystery, clear up the question of how long does it stay on a surface?
Yeah, it depends on the surface. So it can last as little as a few hours. If we're talking about gloves, it can last a few days when you're talking about wood or glass or other surfaces. So that speaks to the importance of wiping down high contact surfaces, handrails, chairs, desks, tabletops, countertops, doorknobs, light switches. All of those areas are areas that are high contact touch surfaces, and we should be very diligent about wiping those down at least once a day, if not more often.
And we're also getting a lot of questions from people, even in our own newsroom. We are down to a very diminished staff, but people are saying, okay, what about my clothes when I go home? Should I take all my clothes off in the garage or whatever and then immediately wash them? Or what is the smartest advice on clothes and not bringing it in?
Yeah, I don't think that that's necessary, frankly. Certainly, people who work in higher risk exposure settings, like healthcare workers, may want to take extra caution in terms of changing their work attire and maybe having a dedicated laundry solution for their clothes when they're changing out of them and washing them at high temperatures. I think for everyday people, you probably don't have to do that. Let's not forget, you shouldn't be out of your home very often anyway, so you shouldn't have to change your clothes.
Right, but if you go out for a walk on your own and you walk back into the house, you should be fine.
You should be just fine.
You've not been in contact with anybody else, I guess, is the key to that.
That's correct.
And other surfaces, I think that's the thing we don't realize. Like when you brush your teeth, you should right away clean the taps, your faucets, right away.
Well, ideally, you can do this in a systematic fashion. So if you spend a few minutes doing particular parts of the house, wiping down doorknobs, faucets, sinks, light switches, that sort of thing, remotes, game controllers,
your iPhone,
your phones, your devices, your tablets. Spend some time dedicated to doing that so that you don't forget. If you're doing it by and by, I think it's going to be easier to lapse.
And it's got to be a habit. You've got to get into that habit. So individual precautions. The immune system is such a complex one, and it is something Brian in Regina, Saskatchewan wants to know more about. He asks, can you please suggest ways that we can protect and strengthen our immune system so that our bodies can fend off the virus or keep it in a mild form? Such a really good question. We've heard all of these things about drink hot water, do this, do that. What can we do personally to sort of better take care of ourselves right now so that we're stronger?
Yeah, so it's a novel coronavirus, but it's an old answer. The old answer is really do the common basic things that you would to take care of yourself. You can't overemphasize the importance of sleep. That's detrimental to the immune system when there's a deficit there. So sleep whenever you can, get as much rest as you can. Eat a healthy, balanced diet, hopefully not all takeout. Exercise, don't forget that that's important. You can still go for walks for exercising, not socializing. And fluid intake is important. But this idea that hot fluids or anything else that's a supplement is somehow going to protect you specifically against COVID-19, that's a dangerous myth to buy into. Please don't believe what you're reading on the internet. Try and get your information from trusted, credible sources and use common sense. Reduce stress as well. Yoga, music, meditation, whatever you need to bring down your stress level. That's going to help your immune system a great deal.
Oh, that's good to know. And while we're on the topic, the UK government was roundly criticized for a policy suggesting herd immunity may be a good way forward, a good strategy. Tell us, first of all, what is herd immunity?
So herd immunity refers to the concept of having enough exposure to a particular infection within a given population so that enough people become immune and the reservoir shrinks. So for example, if enough children have been infected by something and have recovered from it, they may be the main reservoir of spread to older, more susceptible adults, and with enough immunity, that stops happening. The problem with COVID-19 is this is practically brand new within the human population. We're all learning how to adapt to it, including our immune system. We simply don't have the time and the luxury to wait for herd immunity to happen. We need to prevent the infection in the first place and prevent it from being transmitted to others, especially those more vulnerable.
So herd immunity is the wrong strategy for this. I think the UK has figured that one out as well. Our next question comes from a woman who is painfully familiar with the devastating effects of a respiratory virus. Here is question number 12.
Hi, my name is Shanta from the GTA, and my question to you is, as a survivor of H1N1 ARDS, where I was intubated in an induced coma on full life support, tracheostomy, what are my chances of survival if I was to contract COVID-19?
And Shanta gave us a lot more information on her situation. At that time, she was on life support for 6 weeks. So that is an interesting question. She had a different kind of virus, H1N1, if we all remember 2009, the pandemic that hit Canada. And 428 people, doctor, were killed in Canada. Roughly 10% of the population had it. So does Shanta now have an immunity to the coronavirus?
No, not at all. And Shanta, I'm glad that you were able to recover and you're here to ask such a great question for us. It's important to recognize that the influenza virus, including H1N1, is an entirely different family of viruses from the coronaviruses. So there is no quote unquote cross immunity between them. There's really no relationship with them. So we have to do our utmost now to prevent the infection from happening in the first place. To address your question in specific terms, Shanta, without knowing more about your medical history, your age, et cetera, it's difficult for me to predict what your likely response would be to the COVID-19 virus if you were infected. But again, the message should be, let's try and prevent being exposed in the first place. That's why distancing is so critical. That's why hand hygiene is so important. Don't touch your face.
So you're basically starting from scratch then. Anything you may have had, pneumonia in November, doesn't matter now.
Exactly.
Okay, thanks for that. We did see a lot of submissions coming in about reinfection. So if you've already recovered from COVID-19, the question is, can you be reinfected?
You can, but fortunately this is an extremely rare phenomenon. We will learn more as our testing strategies evolve, and we do have hopefully a serology test that can confirm people have become immune. We do have testing strategies right now to confirm that people have become COVID negative if they have gone through an illness phase and they're recovering from the disease. So we'll learn more in the future. So the simple answer is yes, you can, but the good part of that is it's very unlikely that it will happen.
So as like China, for example, is sort of slowly opening up from its 2-month lockdown, we're only going to know as the months progress whether some of those people are infected again.
It's quite possible, and one of the concerns we have is there may be a second wave of infection if our strategies for containment and for infection control are not good enough. And that's why it's really important for everybody to adopt a very consistent attitude and philosophy that we're in this for the long haul. Let's try and adopt healthier lifestyles and healthier habits and maintain them.
I think that's the key right there. I mean, this is life-changing on every level, but the habits we develop now are good ones to continue the rest of our lives, good hygiene and all of that. So we know that those people on the front lines, they have a higher chance of contracting the virus. So it's leaving their families with so many questions, including Lindsay Hanna of Manitoba with question 13. Should my first responder husband distance himself from me and our young kids, or is he safe to be coming home right now?
It's an excellent question, Lindsay. I mean, it's one that I get asked. I'm a healthcare worker. My colleagues are healthcare workers. They've asked me the same thing. I think right now what we're recommending is that we try and minimize any sort of contamination that might occur both with our skin, our mucous membranes, and any attire that might be contaminated with the COVID-19 virus. So I think that if we are commonsensical about changing our work clothes, for example, dedicating a particular laundry cycle to that, wiping down shoes when you come home, taking a shower, making sure that you wash your hair, those are reasonable enough strategies. The good thing is most of us as healthcare workers and frontline workers are not in the highest risk exposure categories in terms of aerosolizing procedures and others that are really going to bring us higher risk in terms of acquiring the infection. So if we employ those strategies that I refer to, I think we'll be fine. We don't want people to be away from their families unnecessarily.
Right. And also, but we ultimately need to protect the people who are protecting us, people like you and your colleagues and the hospital staff. But you just said something interesting. So when they come home, say they are in the healthcare industry, they should come home and wipe off their shoes as well.
Yeah, I think it's a good idea. I think anything that may be in contact with other surfaces in an environment where the coronavirus might be, and we're bound to see more of it in hospitals as weeks evolve, that's probably a reasonable thing to do.
And we should also say that you yourself are taking such extreme precautions to be here to provide this information to Canadians, but also working in a hospital. So tell me the precautions in the newsroom each day you do.
Yeah, I mean, I'm very diligent about making sure I'm maintaining a distance of 6 feet between anyone. We are, religious and fascist, if you will, about wiping down everything from pens that we use to keyboards to surfaces. So thank you, CTV, for leading the way here.
But, we're still on the protection theme. Kathy from Ajax, Ontario sent this one in. This is question 14. I've heard that the hospitals are running out of N95 masks. Would it be of assistance if volunteers here in Canada were to start sewing masks for our healthcare workers? If so, what are the specifications such as fabric and pattern? And Kathy adds she is self-isolating and willing to sew. So I say to everyone out there who has a trunk in the attic full of fabric, crack it open, start sewing. I'm assuming I've seen this initiative go on around the world, but what are your thoughts?
Well, first of all, I want to thank you, Kathy, for your very generous offer. Thankfully, right now, I don't think that we are in a dire situation in most healthcare institutions in terms of a shortage of N95 masks. That is a problem in some of our urgent care clinics and family medicine clinics, so thank you for that offer. I think more importantly, when we talk about who needs these N95 masks, if we're talking about people who are looking after elderly parents or elderly people as personal support workers, and you need a mask and you can't get one, there are lots of different ways that you can make your own mask. You can use cotton, you can use an antimicrobial pillowcase if you want. You can use pretty much anything that is going to withstand a little bit of moisture and can be rewashed.
Okay, so it does protect you then to have that even cloth over your mouth.
Yeah, and remember, the more important thing is also you don't want that to be a substitute for hand washing. You don't want it to be a substitute for not touching your eyes, your mouth, and your nose around that mask. But that's not going to be needed for the general public. This is for people specifically either looking after patients or those taking care of elderly people or those that are immune compromised.
Because that sewing idea was an initiative that started in Seattle, Washington, which was the largest and the first cluster in the United States. And a lot of people, they've even put the pattern online. So your advice to the people out there sitting at home who really do want to do something, anything that they can do, is it may down the road be something helpful.
Sure, and it's a wonderful initiative, and it's wonderful to see people reaching out and helping others. That's a fantastic spirit that we certainly want to celebrate and embrace further.
What about those people who've been hoarding medical supplies? I mean, the impact that has on the people who need it most, as I say, the people who are protecting us.
Yeah, it's obviously upsetting and it's entirely inappropriate. You know, we will run into a situation at some point that if this practice goes on unchecked, we are going to be in a serious shortage situation, and those that are going to need these items for personal protective equipment are going to put themselves at risk. I want to remind people there are 17 doctors who have died in Italy from this. We're talking about putting our lives on the line. We ask people to really respect that, to do your part and to recognize where things are needed most.
And we really are seeing these initiatives everywhere. I know dental offices that have been closed are saying, okay, what can we give to the frontline workers in hospitals? So these things are growing across the country, so keep your eye open for that. And we're obviously trying to bring you all the info, but here's question 15 from Natalie in Calgary.
My question for the doctor is, if the doctors and healthcare providers are taking every possible precaution wearing PPE equipment, then how is it that some of them have contracted the virus and died? Thank you.
It's frightening. Our healthcare workers really are the true heroes in all this. As you just said, over 17 doctors in Italy. So what's your answer to Natalie?
Yeah, it's an unfortunate reality, and I think there are a number of different possibilities for why that might be the case. First of all, we have to recognize that not every case of COVID-19 is necessarily acquired in the hospital. So it's quite possible that those who did acquire this or unfortunately died of it maybe were exposed outside of a hospital environment. Second of all, there's always the possibility that there may have been a lapse in an infection control protocol. And remember, the greater the volume, the greater the intensity, the greater the amount of stress that these healthcare workers are under, the greater the likelihood is that something will give. And that's something we want to avoid.
Okay, so I have to ask, what's it like inside the hospitals right now for you and your colleagues?
It's stressful, there's no question about that, but I'm incredibly heartened and impressed by the level of commitment, the level of selflessness that I'm seeing in my colleagues, both in the emergency room, my internal medicine colleagues, my critical care colleagues, and a whole host of others who have pitched in and rolled up their sleeves and said, I'm going to do what I need to do. It's a fantastic spirit of cooperation. We need that same spirit of cooperation to spread throughout our entire community.
And all those retired nurses, the appeal went out. We first saw it in the province of Quebec. We're seeing it elsewhere. How quick is it for you to say, okay, we've got 10 retired nurses who want to come back to your hospital, Toronto Western, let's get them in there?
Yeah, it's amazing, the resolve that people have shown, and you know, our bureaucratic processes and red tape has fortunately been cut dramatically, and so we now have a system in place where people do want to come out of retirement and help. It's a relatively seamless one.
Well, that's really good news when the red tape gets rolled up and put in a drawer for a while. Here's a very practical question now from Angela in Longueuil, Quebec. Question 16. Is there a proper technique to using disinfectant wipes? Can you use the same wipe to clean a series of doorknobs, or should it be one wipe per job? That is such a great question. Who knew we all had to be so well versed on the technique when it comes to those wipes? But tell me, I'm sure we are all asking that exact question.
Yeah, it's a fantastic question. And really, I think we have to use our common sense as to how much of a surface area you're using per wipe. So doorknobs have a relatively small surface area. It's quite reasonable to use the same wipe to wipe off a series of doorknobs, maybe light switches, game controllers, remote controls, and things of that nature. You probably want to move to a different series and set of wipes if you're talking about wider surface area situations like countertops, tabletops, desks, keyboards, phones and devices. So I would say use at least 4 or 5 wipes if you're going to be going through one floor of your home at a minimum. Obviously, the bigger your home, the more you're going to have to use.
Okay, so obviously we've seen the footage. The shelves are empty. Wipes are harder and harder to find in stores across the country. So we got an email from a retired firefighter, Don Middleton, who asked if some sort of bleach concoction, I'm going to read it exactly so I don't get this wrong, but like 5% bleach in a liter of water would do the same thing. That is how they disinfected their equipment in the fire hall. So what is your opinion on that?
Yeah, this is where it's great to be resourceful and to get a lot of DIY tips to manage this. And there are a plethora of options that you can consider, and there's lots of really good, credible information online, much of which has been validated by the World Health Organization. But bleach is a simple one because it's still relatively plentiful and available in most places. And the solution that I would recommend is about 4 teaspoons of bleach in a liter of water. Put it into a spray bottle like you might use for a Windex. You can spray that on whatever surface you need. Let it sit for a good 10 minutes and then wipe it off with a cloth.
That's great.
If you can do that, it's important. Remember that bleach is a bit caustic and it's not good to inhale. So if you're going to be using it, make sure you open some windows and try not to inhale it directly as much as possible. Or if you've got a mask, that's the time you should be using it.
It's also very destructive on really nice colored clothing. So warning to everyone out there, if you're going to use the bleach technique, don't get any on your clothes. I'm speaking from personal experience on that one. But so that is a really good practical tip. You could do a mix of bleach and water in one of those spray bottles, clearly marked bleach. Spray the countertops, whatever, leave it for 10 minutes. The other one is the timing. I want to go through the topic of hand washing, best techniques.
Yeah, excellent question, and really can't overstate this enough. Few things to remember is, number one, make sure that you are washing your hands properly, which means that you want to use warm or lukewarm water. Don't use hot water. Hot water can actually damage your skin, provide cracks in the skin, increase your risk of skin infection, and it's going to make it worse for your skin hygiene overall. So please use warm water or lukewarm water. Apply the soap. Make sure you're covering all of your skin surfaces, both on top of your hands and palms, and 20 seconds is a minimum. So some people say sing happy birthday. You can come up with a song that
I like
works
the
for
we will survive Gloria Gaynor
that
version
works too.
of washing your hands.
Whatever it
quickly.
does, but it has to be 20 seconds. If you're doing it for less than that, you're not doing it well enough. Get in under your fingernails if you can, in between the web spaces of your fingers. And when you're done, if you're in a public place, take a napkin and close the faucet with a napkin. Don't close it with your hands. If you're at home, hopefully you've wiped off that faucet and your handles already.
So not hot water.
No.
That's a really good thing to know. Warm water.
Warm water.
Warm water only on that. Okay, great. Let's see, where are we going here now? No existing cure or vaccine. There are a lot of theories out there on what might help. Here is number 17.
Hi, my name is Brian Grawn, in domestic isolation with my wife and 3 boys in Surrey, British Columbia. My question is about experimental treatments, with everyone from the US president to doctors and basically everybody online coming up with ideas and potential treatment options. I'm wondering what leeway Canadian doctors have. Do they have the freedom to try whatever they think would work in treating their patients with COVID, extreme cases of COVID-19 who are hospitalized?
Good question, and I can still hear Brian still sounds very congested there, that he's still fighting this thing. But domestic isolation, I like that term, with his wife Stacey and their 3 kids now under 8. So he's not the only one wondering about experimental treatments.
Yeah, it's an excellent question. I hope you feel better soon, Brian, and the rest of your family. The great thing about what's happening right now is that there's been a tremendous collaborative effort that's gone on throughout the world between scientists and researchers trying to expedite clinical trials of various therapies that are being used. Most of them are therapies that have actually already been used for other conditions, autoimmune diseases, for example, like lupus and rheumatoid arthritis. Unfortunately, it takes time to really get statistical power behind these studies and a robustness behind them to make sure that we're not just going by the seat of our pants, if you will, and anecdotally. And so there are certainly a number of things that are being explored, but rest assured that in Canada we've got world-class researchers, we've got world-class doctors and nurses and healthcare staff who are actively looking at this, and we won't be left out if something comes through as a breakthrough protocol for managing this disease.
Unfortunately, a lot of people think Google is gospel, and they're reading online. There's several viewers wrote in about wondering about an alcohol vapor inhalation, something that was suggested online. Can you comment on that?
Yeah, this is dangerous, and this is why it's very important to make sure that whatever you're reading or hearing is from a credible source. There's been talk about drinking copious amounts of very hot liquids, and again, this idea of inhaling hot vapors. It's dangerous to rely on these techniques. They may cause actual harm, especially when you're talking about alcohol vapors. Make sure that you're getting your information from a credible source. Right now, there are protocols underway that are being explored and studied. Get your knowledge and your information from the World Health Organization, from the CDC, from your physicians.
Yeah.
Don't go to the internet, please.
And every medical officer of health in every province in this country, in every city, has on their website all of the information, including our own ctvnews.ca website for questions like that. So really, that's so important. Consider your source, where you're reading this from. But I want to ask about this vaccine for pneumonia. It was another question. It can't prevent COVID-19, but you know, we had viewers writing in wondering if it can prevent someone from developing pneumonia after they've contracted COVID-19.
Absolutely. It's an excellent question, and it speaks to the importance of different vaccines having different benefits. And so remember, we're often exposed to a multitude of different infections in a given season, and that might be bacterial pneumonia, it might be influenza. And if you have one, you may be more susceptible to the other. So it's important to recognize, particularly in people who are immune compromised, people who are elderly, if you get COVID-19, you may be less likely to succumb to a secondary bacterial pneumonia if you have had your pneumonia vaccine. So I would certainly advocate for those at risk over the age of 50, smokers, chronic lung disease, heart disease, diabetes. Speak to your doctor, know if you're eligible for this vaccine, and get it.
What about those people who've been so laissez-faire about the flu shot every September, October? There's a message in here for them also.
Well, I hope this is an excellent reminder for people that these viruses are deadly. And I think the scale and extent of this infection worldwide has grabbed our attention. But the reality is the flu has been around for hundreds of years. We had the Spanish flu in 1918 that claimed 50 million lives. So we're hopeful that we don't want to run into the same bad lessons from history by taking things too lightly. It's important to make sure that the flu vaccine is administered widely across communities. And by the same token, we're talking about distancing, sparing others. When you get your flu vaccine, it protects others around you who are more vulnerable to it. You will shed less virus. You're less likely to give it to someone who's on dialysis, to a cancer patient sitting in a waiting room next to you in a movie theater, etc. So it's all of our responsibility. Please get your flu shot.
Now, a lot of our viewers obviously are forward-thinking, focused on future treatment. Here is question 18 from a 14-year-old viewer in Waterloo.
My name is Om and I'm in grade 8. My question for the coronavirus is there research on finding the vaccine for coronavirus happening currently in Canada? And if so, how are they trying to solve the problem?
Okay, there are some proud parents in Waterloo right now for that great question. Excellent question. The Prime Minister has been asked that himself. He's trying to address it, but it's so important to reiterate, Doctor, what is happening there on the development of a vaccine.
Yeah, no question. And while we're very excited and we're heartened to see that there's been this tremendous collaboration between people here in Canada and around the world, I can't overemphasize the fact that a vaccine is not our solution here. A vaccine is something we're looking for in the future. If and when COVID-19 becomes a regular virus we have to contend with on a seasonal basis. This takes months of development when we talk about purifying the extract from the vaccine to actually formulate it, in terms of animal testing, in terms of testing on healthy volunteers, and then safety assessment beyond that. So we're looking at several months at the very least. We can't afford to look that far ahead. Right now, we have to focus on stemming the tide of this infection right now in our own homes, in our own communities. So hand washing, physical distancing, making sure we take care of all vulnerable segments of the community, that's much more important. Please don't look at the vaccine as a way out of this.
Okay, that's really good. So it's not a solution yet, but it is still very comforting to know that all of the world's top brains are working on this to try to come up with some kind of a vaccine. So we are going to go for number 19 to Saskatchewan.
Hi, my name is Megan, and this is my husband Kurt. We're from Regina, Saskatchewan, and our question for the doctor is:
can our pet dog or cat contract COVID-19 from someone who has tested positive or has it and is asymptomatic? And if so, can that same pet spread it to someone who does not have the virus?
Thank you.
Thank you. That is such a question. So many are asking. Megan and Kurt, along with their cat Gideon and their dog Margot. Great names there. But what's the answer to that?
Yeah, excellent question. The good thing is that it does not appear that pets seem to be affected by COVID-19 very frequently at all. There are certainly case reports of cats and dogs who have been infected by this, but they are extremely rare. And fortunately, there's absolutely no documented evidence to date of a transmission from an infected pet to a human. So this is not something that we need to be necessarily very concerned about. I would say take care of your pet the same way you ordinarily would, by maintaining regular visits to the vet, maintaining regular grooming and hygiene. But go ahead, Margot, and what was the other one's
Gideon.
name? Gideon, fantastic.
But
go ahead.
Those vet clinics, I can't say for sure, but I'm not sure that the grooming salons are probably not open. It's probably not a good idea right now to take your dog into a groomer. But if someone's walking along 6 feet away, they've got those extendo leashes, and the dog comes over to you, or your dog, no problem?
That's fine.
Okay, that's good to know.
Man's best friend.
That's true, and woman's, I might add, as a dog owner myself.
Yes.
But are there extra steps that Canadians should be taking on those all-important daily walks, whether it's with their dog or just on their own?
Yeah, it's an excellent question. Again, we have to remember this is a marathon. It's not a sprint. We are going to need exercise. We are going to need fresh air. And as scary as this is, it's not a nuclear fallout. You are able to get out of your home and to smell some fresh air, but you have to be very cautious and intelligent about how you're doing this. So you don't want to walk in groups at all if it can be avoided. If you're going to talk to your neighbor, do it from across the street. That's okay. You're walking to exercise, not to socialize, to borrow that fantastic line from Premier McNeil from Nova Scotia yesterday. So it's important to get fresh air, but remember, it's not a social activity.
Who should not walk right now? Who should not walk?
Anyone who is under the recommendation of self-isolation should not be out for a walk.
So somebody who's come in from their holiday in the States or wherever, and they are under a 14-day self-isolation, they on their own cannot walk their dog on the street?
They really shouldn't. They really shouldn't. And they should be isolated to their own home environment. And we just want to minimize any potential opportunity for someone who may be at a higher risk of having been infected coming across somebody else. So it's a big ask, but remember, it's temporary. So 2 weeks is something we can get through. Hopefully most of us still have shelter. Hopefully most of us still have light and power. Some of us are not quite as fortunate. So I think we need to take that into perspective here.
The fear is that the virus is airborne.
The virus is not really airborne in most circumstances. So the virus is only airborne during high-risk situations, which mostly happens during medical procedures with vigorous coughing, etc., where you're going to get secretions that fill the air. The virus, we are pretty confident, is a droplet spread, which means that it can't really percolate and spread more than about 6 feet before it lands somewhere else, either on you, hopefully not, or on a surface of some kind.
Thus the 6 foot distance. We got another animal related question for number 20. Not a pet, more like a pest.
Hi, my name is Patrick Doucette in Lunenburg, Nova Scotia. My question is for the doctor, is now that the spring is here, do we have to be worried transmitting the COVID virus through mosquitoes or other bugs that feed on our blood?
Mosquitoes in Lunenburg? I don't know about that one. Tell me though, do we have to worry about mosquitoes?
No. At this point in time, we've never had any experience with any coronavirus, whether it's novel or not, being transmitted through mosquitoes. So we need not worry about COVID-19 specifically related to that. However, it's important to note that mosquitoes can certainly bring a whole host of other conditions with them, including other viruses. And right here in Canada, probably the most important one to be aware of in the summer and early fall is West Nile virus. So we don't want to take mosquitoes lightly. If you are out, Try and wear long sleeves when possible. If you're at a picnic or you're somewhere else, insect repellent is important. Avoid areas of stagnant water where mosquitoes breed. They certainly can bring other problems with them, but COVID-19 is not one of them.
So you just made me think of such an interesting point. We have on some level conditioned ourselves against West Nile, and that came through Canada, and Lyme disease. Some of the measures that we took then in just hiking through a woods or something like that, we will need to implement again this summer. Because I guess one of the issues is whether or not this is seasonal. We received a lot of questions from people saying, hey, like we see the beautiful weather in British Columbia, and you wonder, is that a good thing to keep numbers down, or does weather not matter?
We don't know. There's certainly some idea that with warmer weather, the virus will not really want to sustain itself, or it won't thrive. That's highly speculative at this point in time, so we don't want to count on that. I think we need to count on our own individual healthy habits, and that's going to be far, far more important than waiting for warmer weather to bring this down.
When will we know more about this cycle then?
Excellent question. I wish I had the answer to that. I think we'll have a better idea at some point over the next few weeks when we see the full impact of the containment strategies we're using, of our individual physical distancing strategies, of our self-isolation strategies, etc. We're not going to know for at least a few weeks.
We saw the situation in Italy ratchet up to now it's parks. I mean, you see the city of Milan, not one person walking around in that city. So I guess the question is, are we learning from what they're doing? It's taken them a few weeks to get to this extreme lockdown situation.
I certainly hope we're learning. And again, I remember the important thing is that we really shouldn't be waiting for our governments to impose a strategy for us to contain this virus. We should be looking in the mirror. Every single one of us can do something on our own in terms of our habits, in terms of physical distancing, to make sure that we don't contribute to this spread any further, so that we can stem this tide as quickly as possible. If everybody does what they're supposed to do and really buys into this and takes it seriously and embraces this as an opportunity rather than a curse or a sacrifice, we can look forward to actual picnics and actual barbecues in the summer, not virtual ones.
That's great. It's sort of, you're saying this can be empowering as well. If we look in the mirror and not to our government, we do the right thing. But we are almost out of time, but we do have room for one more before we go. Here it is.
Hi, my name is Carson.
And I'm Lewis.
We're from Calgary, Alberta.
When will things get back to normal?
Okay, so we had to get that bonus question in because of our incredible executive producer, Rosa. Those adorable boys are her nephews, and their parents, Thomas and Tammy, who are watching, I'm sure, from Calgary, have to be proud, because I think Carson, who is 11, and Louis, who's 8 years old, nailed the #1 question on the minds of Canadians tonight. When will things get back to normal?
Yeah, the honest answer is we don't know. But I think what we need to do now is adopt a new normal. And I know that that's been mentioned before, but it's hard to digest. We need to try and remember that if we adopt some of these strategies and healthy habits in our lives, we'll do things in a beneficial way to get onto a normal lifestyle again soon. I'm really confident that if we do that, we will see this through at some point over the next few months. If we don't, unfortunately, this can become much more problematic. Let's have faith in each other. Let's recognize that we're individually accountable to each other. Let's recognize that we have good principles as Canadians. We can embrace this change and embrace it positively and do something we can all be proud of.
And Canada has been so focused on mental health for so many years now, and trying to remove the stigma and all that. Now we have an entire country of people forced into self-isolation for the betterment of the community right now. So give us some coping skills before we leave on trying to stay strong of mind, whether it's learning harmonica or learning a language or what.
Yeah, I think, again, everybody needs to look at this as an opportunity. This has been called a reset for the earth, that there's less of a stamp of pollution being put out, that there's less noise pollution, that families are actually talking more rather than just texting each other. These are all opportunities that we have now that we shouldn't let pass. And at the same time, we're learning great habits about health hygiene and preventing lethal infections from spreading to those more vulnerable around us. Let's not lose sight of that. This is an opportunity that we can use. We will get through it. We have to have faith in each other, but that faith has to start from within.
And it's also true, obviously, when you're cooped up in your house, things can get a little angry when there's kids around, so it's not the talking they might be worried about, it's the screaming. So how do you try to keep the tempers down at a time like this?
Yeah, it's hard. I think we all have to exercise an enormous amount of patience. I've had to deal with it myself. Be patient with each other, cut each other slack. We're all in this together. We all need each other's help.
That's such great advice, and thank you so much for taking the time to answer all of these questions. There were so many, and I also want to thank each of you who took the time to submit a question. As I said, we have received thousands of emails and videos, and our incredible CTVnews.com team and all of us have been trying to get through all of them. I promise we'll have Dr. Sharkawi back, and that'll be soon, I hope. I mean, if we're in this for the long haul, you're going to have more questions as we move forward. But we are coming up on CTV National News very soon, and as we live through events that not too long ago really seemed absolutely unthinkable. The one comfort in all the chaos is knowing that while we're physically distanced, we are not alone. There's strength in that. I'm Lisa Laflamme. Thank you for watching. See you later on CTV National News.